In heterosexual couples, it is often the case that women take on the responsibility of handling all the social relationships for the couple and the children. This seems to fall to women because they are aware that their male partners do not have substantial relationships outside of the family, as they do. To address this, women may pull their partners into socializing with other couples so that they can have more time socializing with each other without it becoming an issue in the marriage. They may even arrange play dates with their friends. Say partners to encourage their own partners to be more interested in socializing as a couple. However, this dynamic has a deeper impact than just the division of social responsibilities. Loneliness is not only an unpleasant feeling, it is an interpersonal impairment that causes significant harm in the lives of men. Research suggests that a focus on the accumulation of wealth and material goods results in less overall happiness in life and less satisfaction in intimate relationships. In fact, the Harvard study of adult development followed a group of men for 8 decades, and throughout the study, the men were asked, "Who would you call in the middle of the night if you were sick or afraid?" The findings revealed that those men who had someone to turn to were happier in their lives and marriages, and also experienced better physical health over time. The danger of loneliness goes beyond the emotional impact. Close relationships with other people have a greater impact on our physical health and longevity than even our genes. A satisfying relationship life can extend longevity by up to 22%. Source nutrition ideas so that loneliness is a risk factor, comparable to smoking, obesity, and high blood pressure. In fact, loneliness in men is correlated with cardiovascular disease and stroke. It is alarming to note that 80% of successful suicides are men, and a leading contributing factor is loneliness. This highlights the urgent need to address the importance of meaningful connections in men's lives. While many physicians focus on risk factors such as smoking and alcohol consumption during annual physicals, it is equally important to inquire about the satisfaction of their patients' closest relationships. The research suggests that healthcare professionals should also consider the quality and depth of these relationships as an integral part of their patients' overall well-being. It is worth noting that women often handle the management of social relationships in the family so seamlessly that their partners remain blissfully unaware of their efforts. Men are often content to have their partners take care of this aspect because they have been socialized not to value social relationships as highly done. On some level, they may also recognize that they are not very skilled at building and maintaining relationships themselves. However, it is typically only when men are divorced or widowed that they realize how few relationships they actually have that have not been arranged or managed by their partner. They discover how vulnerable they have been, depending entirely on their partners for all their connections in life. In conclusion, the responsibility for managing social relationships often falls to women in heterosexual couples. However, this not only places a burden on women, but also leaves men at risk of experiencing loneliness and its detrimental effects. Recognizing the importance of meaningful connections, both emotional and physical, is essential for the overall well-being of men. It is time to acknowledge and address the significance of social relationships in men's lives and ensure that they have their own networks in addition to the support provided by their partners.